That's the thing when you consider progressive overload. Like, and I was saying this to Kyle yesterday. Well, like, you're not progressively overloading the bar, nor are you just progressively overloading your body. You're looking to progressively overload the specific muscle fiber that you're trying to, or muscle fibers or muscle that you're trying to work. So, like, if you're trying to work your quads, it's about finding the way that you can develop the maximum amount of tension on that muscle that's pulling on each bone that it's attached to. Like, that's essentially what you're looking to achieve. So it's not directly correlated with the external load unless everything is completely fine-tuned 100%. And this is the thing, when people start training programs, they often start off with perfect technique.
Perfect.
And then what happens is they're trying to add their 5 kilos each week to the bar, and they do it successfully, but what's been manipulated in the meantime is their technique, their tempo, and the rate of change of their tempo and the amount they're bouncing out of the bottom. And also effort. They're actually, going to much closer to failure than they were at the start of the program, which isn't necessarily a bad thing. But what you've done is tricked yourself into thinking, I've added 20 kilos to my squat, when in reality you've actually altered 4 variables, all of which made it easier for you to not progressively overload the tissue you're trying to overload. And if I was a strength athlete, would my approach be different? Yes.
100%.
If I was training for weightlifting or for powerlifting, would it be different? Yes. But most of you here follow us for the purpose of improving your body composition, trying to look better. And I was just writing about this today, about how we're trying to present to you the best information with how you can improve your muscle mass and stuff, but we're heavily invested in health as well. And one component of health is remaining injury-free, pain-free long-term. So it's about finding that efficient approach that allows you to keep health at the backbone.
Yeah, and this is one of those ones that can kind of mess with your head a little bit, where even as a power athlete or a strength athlete, where you're kind of like progressive, that's what I need to be getting stronger all the time. But that doesn't mean just the year, like you're getting stronger in the year or 2 years, 3 years, the next 5 years. It means like long term. Like if you're overloading tissue, like the hips one that you were always saying about, there's a lot of stuff going on with the hips, and like the way some people squat, really not conducive to long-term hip health, So although you might be able to go, okay, I'm adding 5 kilos or 2.5 kilos every single week to the bar, blah blah blah, it continues to go up, but your technique isn't actually conducive to maintaining your health and your strength long term. Like in 5 years you might be like, I squat 250 kilos, no bother, but in 6 years your hips are in bits.
And that's the thing, and you see that with a lot of powerlifters. Their injuries start to catch up with them over time. And the thing is, like, to be fair, it is kind of part of the sport. Like, you are taking that risk when you try to lift as much weight as you possibly can. But who we're speaking to are people that don't need to take those risks. Like, as hypertrophy focused athletes, we don't need to be taking risks in our training, because we know that we can get adaptations with perfect form that doesn't necessarily permit us of lifting the maximum amount of weights,